I had a dad I was walking down the hallway and this dad kind of pulled me aside into the room and was, like, very upset with the amount of time that him and his girl had been waiting for care. He was just really upset. So I just started by I acknowledged that even though he was upset, I didn't feel like he was dangerous or a threat, so I didn't feel the need to escalate it to the charge nurse or anything like that. So I just let the dad explain in his words just what was going on and like why he was upset. And I just took the time to be thoughtful and really listen to what the dad said. And he explained that he was upset that they've been waiting so long and that the nurse came by once and gave the kid Tylenol, and he's upset because Tylenol can be bought over the counter, and they could have done that at home. And then this ER trip was kind of a waste of time for them. So I let him express his feelings, and then I just acknowledged that it must have been really stressful, and that I'm so sorry that he's been waiting so long in the ER, and that we definitely have not forgot about him. And I asked, can I reassess your child? And the dad was okay with that. So I reassessed, I took all vitals, and I reassessed the child's pain, and the child was still stable, luckily. And the child ranked his pain at a 4. So I just asked if it was okay if I just re-escalated that to my nurse and see if the nurse could come in and give the baby or the child something else. And the dad really liked that answer. So I got the nurse to come in and give him another dose of Tylenol and just tell the family or tell the dad that we were going to recheck in with the doctor and just see where he's at and make sure that, he's going to come around soon. And after that, the dad definitely it de-escalated the situation. And I think the dad just felt better knowing that we didn't forget about him and that we were listening to him and his child and we did care. And I felt like the situation was able to be de-escalated in a safe way and that we were able to just show that we did still care, even though it was a super busy and crazy night on the unit.
If you want to download my list of 72 new grad nursing interview questions, that PDF is linked in the description. Don't pay full price for it as a supporter of the channel. If you use the discount code YouTube, it's only $3. I made it all cute and aesthetic for you guys. It's 22 pages. The idea is hopefully interview day won't be the first day that you encounter whatever question they ask you. I've included every interview question I've ever heard of that any new grad has ever been asked. Don't pay full price for it. As someone who supports the channel, you get it for only $3. Just use the discount code YouTube.
There was a time in my rotation where I overheard a family member getting frustrated in the hallway. So I went over to him and asked him what was going on. And he informed me that his about 20 minutes ago or 15 minutes ago, and that no one's been there to help her clean up. And he said that he was really frustrated because he was told someone would be right there to help her clean up, and he didn't want his sitting in this for that long. And I empathized with him and said I wouldn't want your sitting like that for that long either. I know it must be very uncomfortable, and I understand that this is a very frustrating situation. And this wasn't my patient, but I knew that I did not have any priority tasks going on at the moment. So I believe that teamwork is also a very important thing because we all act as a team. So I went into this nurse's room and I grabbed one of the CNAs that was out in the hallway to assist me with the bed change. And we ended up changing the patient and making sure that she was all dry and comfortable again. And the patient thanked us for giving her the attention that she needed because she was really uncomfortable, and we apologized that she did have to wait for her care. And at the end of the situation, the family member apologized for getting frustrated because he just felt like his deserved faster care, and I informed him that I would do anything I can in the future to help him. And then I went up to his nurse or her nurse and then just told her about like that I changed her bed and everything.
Yeah. I think a phrase that's really helpful for family members is saying, thank you for bringing this to my attention.
Yeah.
Because it's sort of like, I heard you, I'm on it. Like
Yeah.
you did a good job advocating.
Yeah.
An emphasis on like thanking the family member for bringing this to your attention, that we definitely don't want her sitting in. One, because it's uncomfortable, but two, because it can,
Skin breakdown.
yeah, it can be bad for her skin integrity, and that you will find someone immediately who can help. We're gonna make sure she has completely fresh linens, get her all
Mhm.
clean and dry and comfortable. And then, at the end, like, thank you so much again for letting us know. If there's anything else that either of you need, here's your call button. I'll be around as well. So if you need anything, just let us know. Again, sorry about the wait. I appreciate you advocating for her or whatever, just so that they feel heard, they feel valued, they know they're an important part of the care team. Yeah, that would be really good for like the unhappy family member one.
I walked in the room during my clinical experience, and then the patient's wife was yelling at the nurse because I just walked in there and saying that she didn't believe that the proper care was given. The patient was having emesis and he needed a scan of the stomach, but a lot of them was busy, so it kind of kept getting delayed and everything. So I think the important thing in that situation to deal with a difficult patient is to have leave room for open communication and education. So we kind of sat her down and I told her that everything was we're doing all that we can, and it's normal that it keeps getting delayed because of the emergency room, but we were doing everything we can that we promised that we'd do more or do a better job and making them feel that we're not just forgetting about them. And I think another thing too is to just empathize with them. Of course, the wife's husband is in pain. He's having a medical problem that is not even diagnosed yet. So it's important to understand where they're coming from and to know that they just want what's best for their family. So
Okay. So this one, there are parts that I think were good, and then parts that I feel like could be better. The parts that I liked that you acknowledged that they're just trying to help, that you wanted to express empathy. The parts that I feel like could be stronger, when you say sat her down, it kind of seems like you're like, okay, you cool it. Like,
yeah.
The other parts, just telling her we're doing all that we can. I feel like it'd be better to say something like that you had reached out, you assured her, how would you, so starting it, saying, leading up to like how you expressed what the problem was, and then saying that you recognize that she was just trying to advocate for her husband because he was in pain.
Yeah.
So you thanked her for her help, and you told her that you had reached out to CT or whatever it was, to try to expedite the procedure, and that they assured you they'll take her as soon as they can, and that if they don't take him shortly, that you would follow up. And then you tried to see what else you could do for the pain. I don't know if you like offered pain medication or you gave him like a heat pack or like distraction or like any, like, because sometimes with the anxious spouses, it can be helpful to give them something where they feel like they're helping. Even if it's just like a wet towel or like something where they're like, they feel like they're doing something, you know what I mean? Yeah. If you were going to retell the second half of it sort of in that style, how would you do it?
Oh, it's like re-say everything?
I mean, like, you can say the first part about like what the problem was, but then start with like the conversation with her.
Okay, so I think after sitting down with her, I would first hear her concerns and have the open communication and active listening to the patient and their concerns. After that, I would offer to follow up with the emergency department, or I'm sorry, to see if they're still busy in the scanning process for the emergency room. And I would follow up with offering pain medications, and if they wanted their favorite song or music to be playing, I would offer that too as well. Anything to reassure them and hear their concerns for anything.
Okay. I like the part you said about like empathy before and like recognizing that she's just trying to help. I would for sure still say that part, and then say like that you thanked her for advocating and like thanked her for all of her help.